perimenopause, menopause, and cholesterol. Hi, everyone. I'm Dr. Kristi Tompkins, and for over 15 years, I have been specializing in women's health, hormone conditions, and specifically in the areas of perimenopause and menopause. I'm also a women's business coach where I empower women with their health, body, mind, and spirit, help them gain clarity and direction with their business so that they can thrive and prosper in their business and their health. So for today's topic, this is actually one of my favorites, and the reason why it's one of my favorites is because there's a lot of assumptions or myths about cholesterol in general and what it is and what it does, and is it harmful, is it good for you, and specifically in the areas of women's health and perimenopause and menopause, specifically perimenopause and menopause. So with cholesterol, let's break this down. Let's digest this a little bit. So cholesterol is found in humans. It's also found in animals. It is not found in plants, and it is one of those fat-like, waxy substances that encapsulates the cells. It makes up the cell membrane, gives fluidity and structure to the cell membrane, allows for better communication between the cells. It is also needed for producing a lot of our hormones like estrogen, testosterone, pregnenolone, which then gets converted into progesterone. And it also helps support digestion with supporting bile acid production within the liver and gallbladder so that we can break down our fats. So it's got many vital roles in our body. And so with regard to perimenopause and menopause, perimenopause is typically between the ages of 35 and 55. Menopause is when your periods have stopped for 12 months and beyond, and it is not returning. You can still be cycling, not necessarily bleeding, but you might still be cycling for like a lot of women who have, let's say, an IUD, or they've had uterine ablation therapy. You might still be perimenopause, but you may not be bleeding. So you might still be cycling. So with regard to the perimenopause and menopausal years, again, that's going to vary from woman to woman. For a lot of women, their cholesterol levels, and I'm going to break this down even further, tend to rise during this time. It is going to vary from woman to woman based on her lifestyle and to some degree genetics as well. But for a lot of women, their cholesterol tends to rise, specifically the LDL cholesterol. And in some cases, the total number can rise. The total cholesterol can rise as well. And the reason for this is because estrogen, one of our sex steroid hormones that is made predominantly by our ovaries, it's also made a little bit from the adrenal glands, and estrogen can be stored in the fat cells. It often is stored in the adipose tissue in a lot of women and men too. And so with perimenopause and menopause, because our reproductive hormones are naturally dropping and declining and fluctuating over time, estrogen is one of those important sex steroid hormones that helps regulate metabolism with regard to cholesterol metabolism. So with regard to cholesterol, let's jump back a little bit. So cholesterol is a waxy fat-like substance. It is made predominantly in the liver, but you can also get it from food sources. You can also get it from most animal protein, any type of animal flesh, animal tissue. You can also get it from eggs. You can often find it in butter and cow's milk, dairy, goat's milk, sheep's milk, things like that. So we get it through our diet, but it's internally, inherently made by the liver. And so with regard to the specific types of cholesterol. So LDL is the cholesterol that stands for low density, meaning it has a bit more fat and less protein. So it's less dense, whereas HDL has a bit more protein and less of the fat. So commonly, like most people have heard over many decades, is the LDL cholesterol is quote, the bad cholesterol. It's not so much the bad cholesterol. We do need it. Our body does need to produce it. It's all about the balance and the ratio. So with LDL cholesterol, it's the cholesterol that helps with carrying the cholesterol from the liver, delivering it to the rest of the cells, which is essential because all of our cells, all of our organs need cholesterol. And the HDL cholesterol carries it back from the body, back from the cells, back to the liver so it can get metabolized and eliminated and processed and excreted. So there's a balancing, dancing act that happens all the time. With regard to perimenopause and menopause, as estrogen's dropping, that regulation becomes imbalanced. The cholesterol regulation and maintenance becomes imbalanced. And so as estrogen is dropping, and it's going to, again, vary from woman to woman. Some women maintain a healthy amount of estrogen well into their 40s and even their 50s. But in general, again, generally speaking, and I know that's probably not the best thing to say because every woman is different. As estrogen drops, cholesterol tends to rise. LDL rises. HDL may or may not rise. Sometimes it can, sometimes it can drop. So if LDL cholesterol, the quote bad, although it's not really bad, it's all about the moderation, if that rises, the total number rises. So a lot of women will go in to see their conventional doctor, and the total number will show higher than 200. And I don't ignore that, but I really look at that with more of a fine-tooth comb, with more of a microscopic lens, so to speak. So it's not just about the total number, nor is it really about the LDL and the HDL numbers as well. It's really about some additional lipoproteins like LP(a) and apolipoprotein B. Those are typically found and correlated with the LDL cholesterol. So it's really about looking at the individual lipoproteins and other pro-inflammatory markers. And so just doing your basic lipid panel, you're skipping a lot, you're missing a lot of information. And so doctors like myself, functional medicine, naturopathic doctors, will typically run a more advanced cardiolipid panel where you can actually see a lot more of those markers. And again, that is going to be relative and should be compared to your diet and your lifestyle. So with estrogen dropping, cholesterol can rise. It's not inevitable for every woman. That is modifiable through your diet and your lifestyle, as I just mentioned, which is always important. It's always important at any age and certainly at any decade. But the key here I really want to emphasize is that as we're younger, because we have typically such high reproductive sex steroid hormones, when we're in our fertile reproductive years, we're producing a lot of those hormones. So that naturally, even if we might be eating a higher cholesterol diet or a high fat diet, because of those high sex steroid hormones and our increased metabolic rate in general, generally speaking, we can clear the extra LDL cholesterol. And so for a perimenopausal woman, menopausal women, those lipids start to climb. And what this really indicates is that, as I always mention with a lot of my clients and a lot of like my own podcasts and a lot of videos that I do here on YouTube, is that this is the perfect time to make adaptations and adjustments to your life, to your diet, to your exercise, your overall health and well-being program or protocol that you have either in place, or if you're working with a doctor, functional medicine, naturopathic doctor, other types of holistic practitioners that can help you. Usually that can be mitigated. It can be alleviated. So it's not necessarily a sentence or certainly something that's inevitable for every woman to have elevated cholesterol. Back to cholesterol. Cholesterol is not a bad thing. It is something, as I mentioned at the beginning, it's essential. We need to produce plenty of it. And I will tell you that in all the years that I've been in practice, a lot of my female clients that are really healthy, they are eating a wholesome, nutritious, whole foods, paleo type of diet, maybe some intermittent fasting, lots of vegetables and fruits and healthy sources of protein, healthy fats, and they're exercising. Their total cholesterol and specifically their HDL might be a bit on the higher side. So if the HDL is a bit on the higher side because of that healthy diet and activity and lifestyle, the HDL goes up, which naturally rises or raises the total number. It can, in some cases, raise the LDL, but it's all relative. So looking at all the different lipid markers and in conjunction with what she's doing in her life really is the key factor here, because it doesn't necessarily mean that she has to stop eating cholesterol, stop eating animal products, become a vegan, become a vegetarian, or get on, be prescribed a statin medication or a cholesterol lowering medication. That would actually be a disservice and could potentially cause harm to the body and adverse effects. But let's say the LDL cholesterol is starting to climb quite a bit, and the HDL is high, which is actually what you want, then this might be the perfect time to look at what she is putting into her body. Are there more refined carbohydrates? Are there more processed carbohydrates? A lot of packaged foods, a lot of food, maybe fried foods, a lot of seed oils, a lot of like high, artificial ingredients. There are other things, obviously sugar, alcohol, lots of other types of foods that might be making her lipid levels, and not just her lipid levels, but also her glucose, her her blood sugar, her insulin, those might be off as well, which is also very common for a lot of women during this time. And because of perimenopause and menopause, and so that will increase the risk to some degree for insulin resistance, and therefore higher glucose and potentially more fat storage. So this might be that opportunity to really clean up the diet and really talk to a naturopathic doctor, functional medicine practitioner, nutritionist who can really get you on the right path to putting good quality, better quality foods into your body, so that not only your LDL cholesterol and your glucose and all those other markers tend to drop, but you're also feeling better. You're also dropping extra weight. So belly fat specifically. So on the topic of belly fat, which tends to be more common for a lot of women during perimenopause and menopause, a lot of times the women will gain a lot more abdominal fat during the midsection. And this is related to, again, that drop in estrogen, and estrogen helps with fat storage regulation throughout the body. And it tends to be a bit more centrally located in the abdominal region. So belly fat is usually a combination of visceral fat and subcutaneous fat. And so the visceral fat would be the fat that surrounds our internal organs, like our liver and our stomach, pancreas. And then the subcutaneous fat is obviously the fat that you see visibly. If you were to see that, pinch it, most of us have that, usually around our midsection. Some people are a lot more lean based on their lifestyle, their diet, their exercise, age, gender, all of that plays a big role. For perimenopause and menopausal women, that is one of the more common reactions or results from perimenopause and menopause. And so that extra body fat, visceral fat, subcutaneous fat, can often increase triglycerides in the body. That's another fat that is made in the liver, but it's also, we get it through our diet, but that can also raise LDL cholesterol if we have more body fat. So the two are kind of feeding each other, so to speak. With regard to perimenopause and menopause, a lot of women notice a bit more cravings, food cravings. Maybe it's carbohydrate cravings because of hormone changes, because of not sleeping well. That's also another common symptom of changes in reproductive hormones. So not sleeping well, that tends to make you crave more carbohydrates, which then leads to more higher glucose, and that leads to more body fat storage. And so that can also cause what's called dyslipidemia, where the cholesterol levels might be a little bit higher, LDL cholesterol, triglycerides might be a little bit elevated, and so forth. With regard to perimenopause and menopause, a lot of women notice that their ability to adapt to stress is less. They don't quite have that resiliency that we did when we were younger. Those reproductive hormones, our adrenal hormones, often our thyroid hormone, all of that collectively, our emotional ability to emotionally regulate, all of that helps to mitigate or balance the stress hormones like cortisol, epinephrine. And a lot of times with perimenopause and menopause, women are less likely to adapt. They're more reactive. And so difficulty adapting to change and stressors and other types of circumstances in our life. And so that extra stress will also cause changes in blood sugar levels, cholesterol, triglycerides. It affects the entire body, but that can cause more, quote, inflammation or pro-inflammatory markers throughout the body, in the blood vessels, different, our muscles, our skin, our brain. And so sometimes that can directly or indirectly lead to more dyslipidemia. So one of the things I want to come back to is that all of this is modifiable. All of this is manageable. It is not necessarily the case where you're going to have high cholesterol that is going to be potentially life-threatening. And when I say life-threatening, that would be you have increased risk for metabolic syndrome, you have increased risk for diabetes, increased risk for heart disease, increased risk for obesity. That can be the case for some women, but because the body is changing physically, emotionally, psychologically, for a lot of women, this is the perfect time to really make those changes. So if you're not already eating a clean, healthy, low inflammatory diet already, or you've gotten off track, this is the perfect opportunity to get your body back on track. And a lot of times, eat even healthier than you did before. This can also be the perfect opportunity to help focus on what type of exercise you're doing. So not just walking, not just running if you're running or doing aerobic conditioning, but also getting into muscle strengthening, strength training, using your own body resistance, using dumbbells, weights, machines at your gym. And what that does is it raises your metabolic rate. Naturally, your overall metabolism that is mainly controlled by your thyroid, also other organs in the body too, but that raises your metabolic rate so that you can clear the extra body fat, but then you can also clear the extra LDL cholesterol. You can clear the extra cortisol. You can clear the extra insulin and glucose. You can clear the things that are abnormally high when your overall metabolism is higher. So the muscle strengthening helps with not only building stronger muscles, it also helps with energy, utilization of the energy in the form of food, and also rebalancing those lipid levels, and also helping you drop body fat as well. With regard to sleep, as I mentioned earlier, because sleep becomes erratic, it becomes interrupted for a lot of perimenopause and menopausal women, whether you're waking up in the middle of the night and you have trouble going back to sleep, or you're waking up in the early morning hours, or for some women, they have trouble or difficulty falling asleep because of drops in progesterone and in estrogen. A lot of women will notice that because of that stressor of not getting enough sleep, that can cause extra body weight, specifically belly fat, and then that can also cause higher amounts of either triglycerides or LDL cholesterol in the body, but it can also lead to those sugar cravings or caffeine cravings, all of which can raise your glucose, your insulin, your fat storage, and therefore high cholesterol. So this becomes a prime opportunity and gift. I call it the gift of perimenopause and menopause, even though some of you may not feel like it's a gift, more of a curse. It can be a blessing in the sense that you can make the essential changes that you need to make to be healthy from head to toe, and not just based on your lab results, but truly be healthy, and even healthier than maybe you were back in your 20s or teens. I know I was not healthy back in my 20s and teens. I was eating, your typical teenage diet, a lot of processed foods, a lot of fast foods, a lot of sodas, a lot of sugar. I don't think I ever ate a salad unless it was like iceberg with a lot of ranch dressing and lots of gluten and dairy and cookie. Yeah, it was a hot mess diet. So obviously I've learned over the years through my training in dietetics, nutrition, naturopathic medicine, additional training in functional medicine. And so I obviously know what to eat most of the time. I recognize it. I practice what I preach. I eat a healthy diet. I exercise. I take my supplements. I do all the things. That's not to say it's perfect, and that's not the expectation here, is to be perfect or have the perfect protocol or program in place. It's really about moderation and balance and doing what you can most of the time to help your body. If you need help, as we all do, working with somebody like me, naturopathic doctor, functional medicine practitioner, who really understands from that deeper root cause system, body systems based approach, and specifically in the areas of perimenopause and menopause, that's really going to be your best bet, is working with somebody like myself who is trained and seasoned in helping you understand what all the lab tests mean, but also giving you a personalized protocol that's right for you and personalized for your body and your health. So that's it for today. I know that was a handful. That was a lot of science there. So I hope you learned a lot. Share this video with a friend. Share this with a female friend who would love to hear this or would love to benefit. Subscribe to this channel if you haven't already, and we'll see you next time.